Thank you all so much for coming tonight. We're going to start the evening off introducing our delegate, Dustin Wade.
Thank everybody for coming out today. I put this town hall together to talk about the community barriers in mental health care and healthcare period for the District 75. I'm running for the Virginia House of Delegates. I was born and raised in this district. I was actually born right here in the hospital in Hopewell. I'm a nurse and a mental health professional, and one of the things that nurses do, we make assessments, and that's one of the things that I'm doing here today is I'm making an assessment of the community's needs and the things that we can do. So I brought together a panel of professionals that can help give some insight on. Our first guest speaker tonight will be Lauren Wickline, who is a licensed mental health professional. So without anything else to say, really, here's Lauren, right?
Well, Dustin, thank you so much for having me, and I do apologize about how brief this is going to be. When you first asked me to do it, I realized I have another obligation this evening, but I couldn't resist coming down and just to speak out on some concerns that we have just in general in the mental health field. So about me, I'm a licensed, I'm an LPC, and I currently work in an inpatient psychiatric setting. And my current location is in Emporia, Virginia, but I also work out of Southside as well. And I wanted to come here to discuss my biggest concern as a licensed mental health professional from the hospital setting is discharge planning. That seems to, and I see head nods already, that seems to be the biggest barrier as far as getting patients step-down services. So just a little bit about psychiatric inpatient, the admission process. So in order to be admitted to an inpatient facility, you have to meet different criteria. And those criteria include, suicidal ideations, hallucinations, or homicidal ideations, or lacking capacity, okay? So a lot of people come in either on a voluntary or an involuntary basis, and they tend to stay anywhere up to 5 to 7 days, but sometimes it can go up to a month, depending on placement issues, and that's the main thing I want to talk about with placement issues after leaving the hospital. So that's just the criteria for it. So with step-down services, some of the biggest concerns I am seeing is where do patients go if they happen to be unhoused? Where do they go after they leave the hospital? So, and I do want to clarify a few things. We do get patients who come in the inpatient setting who have a comorbid diagnosis of substance use. That usually is not an issue because our goal, as soon as they come in inpatient, we want to get them to an inpatient rehab. The idea is door to door to reduce risk of relapse. Where we're seeing some problems are the patients that substance use is not their primary diagnosis, but they still need step-down services, and I will give you an example of that. A lot of patients are waiting for whether it's group home placement, assisted living placement, or just need regular housing because of certain situations. And the issue that I'm seeing is there really is not a lot of crisis stabilization resources. So where I am, we do get a lot of brochures and flyers for crisis stabilization. So crisis stabilization, and again, I'm sure there's people here who can speak about it better than I can because I've just referred to people out there. Crisis basically gets a patient to, whether it's a temporary housing situation, whether it's like a hotel, or whether it's a crisis home. But the problem is, usually Medicaid only covers that for up to a week, and sometimes not even that. So the problem with that is the group home placement or assisted living placement could take longer than that. On my end, what I try to do is I try to keep them in the hospital as long as possible until there's definite guaranteed placement. But as you all know, the issue is with inpatient criteria, once they don't meet the criteria any longer, they're pushing, okay, they need a step-down service, they need a step-down service. I mean, they're pushing us to get them somewhere. So the crisis stabilization services that I've currently referred patients to, they're very helpful, but again, it's only usually a week, and that's the issue. And what I would love to see, what I would love to advocate for is extended Medicaid funding for maybe longer term crisis stabilization placement until a group home placement can be had. Because I'm sure, again, people here can speak on this, the group home placement can be a process. You have to wait for a bed. You have to fill out a uniform assessment to get them there, and you have to be approved. And sometimes it's an interview process, and it can be a while. I feel like the benefit of crisis stabilization, that steps them down from the hospital. So it's almost like, in my ideal magic wand world, I would love to see a crisis home where it's like almost like a mock group home, like basically a sample of, hey, this is what you're to expect, this is what this is, and that sort of thing. For maybe like a month, that would be ideal, because really a week in crisis after discharge, we see a lot of patients come right back in the hospital because whether their housing placement didn't fall through or their group home placement didn't fall through. And then of course, when the crisis ends, you know, the crisis funding ends for that week, they have nowhere to go. And they usually end up either, if it's substance use, they end up using again or get re-hospitalized. And then as you know, with medication, decompensate because they're not getting medication. So that's where we see the biggest re-hospitalization rates. And again, I don't know what is able to be done in this area, but Medicare, that's my biggest beast to try to place people. Medicaid does have great resources, and I'm able to place people when they leave the hospital, but people with like private insurance or Medicare especially, if they need like a step-down placement, that's where I'm really struggling to find placement. So that's what I am here to advocate for today, is I would love to have additional resources, either from the definitely from the Medicaid, but even the Medicare end of things, just for more step-down services, because going from acute inpatient and going straight to a group home, I mean, sometimes it's able to happen. Sometimes it is able to go straight door to door. That's obviously ideal, but sometimes it can take a while, up to months. And I would love to have more resources for that. So I'll take any questions, comments. No? Thank you. Appreciate it.
Yes. Next, we'll have Hugh Briscoe.
Well, good afternoon, everybody. I am Sharika Lampkin Briscoe. I am one half of Briscoe Way Services. I'm with Briscoe Way LLC. My wife, Kia Briscoe, and I founded Briscoe Way Services as a way to provide resources to the recovery community. I am a person in long-term recovery. I have 13 years in mental health and substance use recovery. Being a person with lived experience, there are a lot of barriers that we face as individuals. One, just being able to build the confidence to learn how to love us, let alone getting someone else to understand who we are, what we are, and that we all deserve another opportunity. I worked for several community service boards within the local area that service the Hopewell area, and what I realized is that they're stretched thin. And so Hopewell misses out on a lot of opportunity to be able to support the community in which they serve because the resources aren't there. By resources, I mean recovery housing. I mean having community service boards dedicated to this specific area. I mean having treatment facilities that are located right here and not having to go an hour or 2 hours away. Yeah, we have about 1 or 2. But when you look at what Hopewell has to offer, all the free space that we have that we're not utilizing, where is the support? Now, this isn't just about, okay, someone who is coming from a hospital, whether it's the hospital right up the street or whether they happen to come from Southside Regional. We're talking about how we treat our individuals that are asking for help and there's no help to give them. And with that being said, the barriers that we're facing as a recovery community in Virginia, but more in the Hopewell area, is the fact that we do not have the resources here. We do not have the funding. If you have a person that does not have insurance, or their particular insurance carrier does not is not accepted somewhere, then guess what? They're back on the street. Which means that then they go back to the hospital. Which means that then they get put out because they don't meet the requirements. Right? Which then means we have a possibility of somebody overdoses or going into psychosis because they do not have the support. Now, for a long time, I've heard so many politicians say, I'm gonna put my money where my mouth is. I'm gonna invest in the people. Well, because I've gotten to know Dustin a lot more, I know that he is where he says he's gonna be. So if he says he's gonna do something, it does my heart justice to know that he's gonna do it. But today what we're asking for is not only the conversation of putting it here, but the footwork of putting it here. So maybe that is adding a recovery home that specializes in mental health and substance use support. Maybe that is a step-down service of a crisis stabilization and also another treatment facility. So we have a 3.0, we have a 3.1, we have a 2.5 and a 2.1, right? But we also need those resources, food pantries, shelters. We need to be able to serve the members of Hopewell who live with so many different disorders, mental health disorders, who are afraid to go to the hospital. So where's the hand-to-hand community care? The opportunity to bring what Hopewell needs, which is people that care and resources that will enable them to be the best version of themselves. Recovery is just what it is. Recovery looks like me, but recovery can look like so many others. But do they have the opportunity? Do we give them the space? Do we support them and back them? And we have such a bold opportunity, even in this political climate, to back what we're saying when it comes to what is in everybody's front and backyard. How long do we have to wait? Do it have to come to your front yard? Do it need to come to your front door? Do it need to lay in your bed before you open your eyes and realize that we are taking away from people who need it and putting it in the pockets of those who don't? We are around the corner from a library that on any given day, there are hundreds of unhoused individuals with mental health diagnosis and substance use diagnosis just sitting outside. And we pass them by. And we say they're the problem. They're not the problem. We are. And so what I'm asking for from the delegate that's running is to stand up and start doing something different. Whether it be voting to buy a community space that's empty and put something there that's meaningful, whatever that looks like. But I thank y'all. And that's all I have.
Next up, we've got Robert Gill.
Hey, how are y'all? Hey, my role, I work for Richmond Behavioral Health, and I'm with the crisis response team, working with the police department, and we ride out with the police on crisis calls, either 988, 911. It can go several different ways. I'm a peer. I'm a person in long-term recovery. I had 23 years clean. And our work, you know, we work under a Marcus Alert, and Marcus Alert is a guy, a teacher in Richmond, had a mental health break, and you know he ended up getting shot by the police. And so the state of Virginia created, and I think it's going to come to Hopewell eventually, created a team that, you know, a clinician and a peer can ride with the police, and they secure the scene, and then we go in and, you know, talk to them. And the basic thing is to keep, and I hate saying this, but it's true, is to keep the police from shooting them, right? And it can go anything from people jumping off bridges to murders in the community. We do, we were just talking about it prior to this, is that we do community resets to where if somebody is murdered in the community, within 24 hours, we're in that community, knocking on doors and telling them where they can get services, You know, if their children need services, you know, it's a traumatic situation. So we're offering services. So my role is different than most peers, right? I'm a guy with lived experience, and I don't have a problem telling anybody. You know, I was a drug addict. I am still a drug addict, to be honest with you. You know, because addiction is a disease, a life-threatening disease that I'm constantly in recovery. So my role is to let people know that there is a way out, right? And I get kind of street cred with them because when I walk and go, hey man, I've been locked up before, I've been in prison before, and I know what you're going through, so they can connect to me better, and they have more trust to my role with them. So, you know, I'm a lifelong Hopewell resident, born and raised, like you said, in John Randolph Hospital. And I still live in the house my grandfather built in 1913, right? And so, you know, the community means a lot to me. So, you know, I would hope that they would get the funding, the local police department, to enact this Marcus Alert program. Because I think Chesterfield does it, Henrico's doing it, Virginia Beach is doing it, more of the bigger communities, but they have to have funding. And it's important because Hopewell has their own set of problems. So, you know, I really like what I do. I do like what I do. I was talking about it can be emotionally charged. Right? You know, because when we go out and make contact with people in the street, our contact, you know, is for 60 days maximum. You know, because then we turn them over to other services, and we hope we get them in line. So, you know, and I think Hopewell could use this. You know, Hopewell doesn't have it, Petersburg doesn't have it. You know, the counties, you know, the smaller counties, Surrey, Sussex, they don't have this. And so, you know, and we have the same problems that the city of Richmond has. And so, you know, I'm glad to be here, and you know, I really want to support anybody who needs help. So, you know, again, my name is Bob Gill. I'm a peer, you know, certified peer recovery specialist, and I love my job.
And then our final speaker is Olivia Iavina.
Hi, thanks so much for having me. I'm a family nurse practitioner. I've been a nurse practitioner since 2015, and I've been in healthcare since 2009. I worked in the hospital as a nurse assistant and a unit secretary, went to nursing school, got my bachelor's in nursing, and I was an RN in oncology in the hospital for 4 years. And then I've been in family practice for almost 10 years now. So I've done family practice, some retail health, and also some telemedicine. And the things that I would ask for a delegate working on improving the healthcare of our communities. One thing I think is extremely important is just basic nutrition and basic health, especially for children, and really for everyone, but it has to start young to help prevent future disease. If we want to prevent adult obesity, it has to start in the childhood. If we want to prevent diabetes, if we want to promote understanding of what is going to keep you healthy, then it has to start in childhood. And I would love to see programs where we could bring in community gardens in elementary schools and middle schools, in our public areas, where we can actually have fresh vegetables, fresh fruits, and teach people to grow them themselves, to care for themselves, to get the exercise of gardening, and really start learning about basic health right from the beginning. I also think it's really important to start with kids in getting a stronger promotion for going into being healthcare providers, because if you feel like your doctor, your therapist doesn't respect you or look like you or think like you, you might not be willing to open up to them. I've had so many patients who've told me how much they've struggled with not being listened to, not being heard, being judged, not wanting to admit what problems they have. And so if we can promote more girls in STEM programs, children in STEM programs, so that they want to go into health professions. We're having fewer and fewer people entering into health professions. We need to get funding and support so that children can grow up with confidence and be representatives of their community and want to give back and support their community as their community supported them in their childhood. And then another very, very important issue to me is access to care. And I think we've all been talking about that tonight. And for me, knowing that there are just not enough primary care providers, there are not enough specialists, there's not enough mental health workers, being creative and thinking outside the box. So a program where, as you mentioned, the library right down the street, let's have a few rooms that could have a private computer with a webcam set up in them so people can go and have a telemedicine visit with their therapist, or a telemedicine visit with a primary care doctor that they couldn't drive the 50 minutes to, or they don't drive, or they don't, the car's not working, the bus is going to take too long, and instead they could, have their appointment and then, have their couple kids, group their kids, to have everybody seen, where they would have no health care option. They don't have the reception in their home. They don't have a computer in their home. There's just not the availability. We're not going to be able to solve the problem of not having enough healthcare providers tomorrow. It's just not going to happen. So instead, we need to think of ways, how do we get the healthcare providers to the patients, or the patients to the healthcare providers? So that's funding for transportation, for Medicaid and Medicare funded transportation to appointments, but that's also expanding access to the telemedicine services so that people can see the primary, see the specialist, see the therapist. So those are the priorities I think are especially important in this community. We don't want to be living in a healthcare desert. We want everyone to have access. And so I think we need to come up with those solutions, and technology provides them for us. So let's build the platform that we can integrate those into our communities. So those are the main things that I wanted to talk about today, and on my wish list of how to improve our community health.
Thank you.
Was there anybody here tonight that had any questions for any of our guest speakers?
Me.
We're still on live, right? So let's just see if there's anybody that's got a question or concern that's watching live that we could comment to on. I'm sorry.
I just wondered, Medicare funding, it's tricky right now. But, for example, if Abigail, they would maintain the Democratic majority in the House and the Senate next year, is there any way to increase if we are able to keep Medicaid as it is right now, can Medicaid be increased the amount? I mean, I
I think
don't
it
know where
can
the
be increase the
funding.
budget for that. We'd have to do the House, but we're working currently, from what I'm understanding, to put everything in place to try to maintain Medicaid as it is with the state funding that we have coming in, is what I'm understanding.
Okay.
We're trying to rapidly with what we have on our hands. That's why we need to have a trifecta with make sure we get the governorship and maintain the House and the Senate, so that the state legislative branch can
But
do
if,
something.
if Virginia remains Democratic, we keep it blue, we still have the issue coming out of DC
Yes,
for 2 more years.
absolutely.
So, is that, so we really don't know anything except.
No, especially I think it was more solid when we had the tax dollars still coming in from the federal employees. Now the federal employees, they're not pouring tax dollars in, so it would have to be some budget reform and just, we'd have to have a Democratic majority, I think, to maintain that and keep that mindset going forward.
Okay. Yeah. I did see where he vetoed the increase in the minimum wage, that's the only.
Absolutely. Absolutely. Is there any other questions?
Is there any online questions for anybody that's watching? All right. we can
Well,
just wrap it up.
there's 4 things that I can get from people right now that are watching or that are here. I need your engagement. If you can follow all of my social media. You can vote for me if you're in my district, obviously. And then also I need volunteers, hands on doors, door knocking, phone calls, emails, and then of course I also need money to continue this campaign. So if you have any questions, please visit DustinWaitForVirginia.org. Thank you so much, and I'll be looking back to the comments and answering questions off the live. Thank you.
But do you have a Facebook page?
We do.
Okay.
It's all of my Facebook and social media is DustinWaitForVirginia.org. You'll be able to follow it there.
That's probably on here somewhere.
Absolutely.
Okay.
Any other questions?